Welcome to this detailed video on the clinical applications of stress echocardiography by physical exercise. This test is a powerful tool used widely in diagnosing and managing cardiovascular diseases. In this video, we'll explore some of the key applications. Let's start with the diagnosis of coronary artery disease, or CAD. Stress echocardiography is essential for detecting ischemia, identifying areas of the heart muscle that do not receive adequate blood flow during exercise. This makes it a crucial test for diagnosing CAD, where blockages or narrowing in the coronary arteries restrict blood flow. It also aids in risk stratification, helping determine the severity of CAD and guiding decisions on further interventions, such as angiography or revascularization procedures. For patients with chest pain, stress echocardiography is invaluable in evaluating whether the pain is cardiac-related or due to another non-cardiac cause. By assessing blood flow during exercise, the test helps differentiate between cardiac and non-cardiac causes of chest pain, such as angina caused by CAD. The test also plays a critical role in assessing heart valve disease. Stress echocardiography is used to evaluate valve function under stress, helping determine the severity of conditions like aortic stenosis, mitral regurgitation, and mitral stenosis. It's also important in the pre-surgical evaluation, helping to assess the necessity and timing of valve surgery by evaluating how the valves and the heart respond to increased workload. For patients with known coronary artery disease, stress echocardiography is an effective tool for monitoring the condition. After interventions like angioplasty or coronary artery bypass surgery, the test is used to assess the success of the procedure and to monitor for any recurrence of ischemia. It also helps in monitoring disease progression in stable CAD patients and assessing the effectiveness of medical therapy. Another important application is the preoperative cardiac evaluation. For patients undergoing non-cardiac surgery, particularly those at intermediate or high risk for cardiovascular events, stress echocardiography is used to assess the risk of perioperative complications. This is especially relevant for surgeries that place significant stress on the heart, such as major vascular or orthopedic surgeries. Stress echocardiography is also valuable in the assessment of heart failure. The test helps differentiate between ischemic cardiomyopathy, caused by CAD, and non-ischemic cardiomyopathy, which may result from conditions like hypertension or myocarditis. Additionally, it evaluates the heart's functional capacity and reserve, which is essential for planning treatment strategies in heart failure patients. For patients experiencing unexplained symptoms like shortness of breath or fatigue during exercise, stress echocardiography can determine if these symptoms are due to cardiac causes, such as left ventricular dysfunction or valvular disease, or if they might be related to pulmonary or other non-cardiac issues. In detecting exercise-induced arrhythmias, stress echocardiography is particularly useful. It helps identify arrhythmias that occur during exercise and assesses their impact on heart function, which is crucial for patients with palpitations or a history of fainting during physical activity. The test is also used to evaluate right heart function, especially in the context of pulmonary hypertension. It assesses how the right side of the heart responds to exercise, providing valuable insights for diagnosing and managing pulmonary hypertension and right heart failure. In hypertrophic cardiomyopathy, or HCM, stress echocardiography is used to assess the severity of left ventricular outflow tract obstruction during exercise. This helps guide treatment decisions and stratifies the risk for sudden cardiac death, particularly in patients who develop significant outflow obstruction or ischemia during exercise. Lastly, stress echocardiography is widely used in research and clinical trials. It's a key tool for evaluating new therapies and studying disease mechanisms, providing critical information on how the heart responds to stress at various stages of disease progression. In summary, stress echocardiography by physical exercise is a versatile and invaluable tool in cardiology. It provides critical information for diagnosing, managing and monitoring a wide range of heart conditions, allowing clinicians to tailor treatment plans based on how the heart performs under stress. Thank you for watching. If you believe stress echocardiography might benefit you, or if you have any concerns about your heart health, please consult your healthcare provider.